guys, welcome back to my channel. In today's video, I am going to show you my nursing brain sheet so that you can stay organized during your clinical shift. So you're probably wondering, what is a brain sheet? Well, a brain sheet is a nursing report sheet. And as a new grad, it can be really overwhelming to receive a lot of information at once. When you're receiving report, whether you're giving report, it's just a lot of information. It could be hella stressful. So I'm going to show you my report sheet, and I have linked it down below in the description box so you guys can follow along, or you can print it and edit it however you want to. My specific brain sheet is specific to postpartum patients, so it may not apply to you. I do have pregnant patients sometimes, so this sheet I do not use for that. So this is what my brain sheet looks like, and I'm definitely going to do a close-up and show you guys exactly how I fill it out, but this is a blank sheet. So each section of my piece of paper or my brain sheet is divided into 4, and within a section it is further divided into mom and baby. So we usually have 4, sometimes even 5 couplets, which makes this sheet work really well because then I can look at all of my tasks and all of the things I need to do on one specific page. So within each quarter, I have the mom and baby's information. Really compact and easy to use because I can fold it in half and then I can fold it in half again. So now I have my 4 patients, and it's just a great way to organize it so that I don't lose it and it can fit nice and snug inside my scrub pocket. Okay, so I just zoomed in a little bit so you guys can see. So as you can see on the right here, I have a patient that I've actually filled out, and of course this is all fake, this is all made up, just so you guys know as a disclaimer. And on the left over here is a blank section. So I'm just going to be comparing the two. So first of all, right above each section, I do have a blank space. So over here is where the patient's sticker will go. So usually that will have the patient's name and date of birth. So that's why it's not included in each of these sections, in case you're wondering. For now, I basically just used one of these stickers that I had at home. The first thing that the section says is the time and date that the patient delivered on. So over here I've written delivered on September 20th at 13:05, and then we have the room number. Now the next thing we have is whether or not they were a vaginal delivery or a C-section. So again, this just really depends on the patient. So I do have a blank over here, as you can see. So here I wrote spontaneous, just so I know that it was a spontaneous vaginal delivery. It could be natural childbirth. It could be they were induced. For C-sections, they could be breech or whatever. So I just have that blank over there. G and P stands for gravida and para, and then we have the gestation. So this patient we're going to say is 37 and 6 weeks. Next, we have a bunch of serology. So here I have Hep B, HIV, rubella. So I just write whether they're negative, whether they're immune or non-immune or indeterminate, their blood type, their GBS status, if they're positive, how many doses of antibiotics did they receive. ROM stands for rupture of membrane. So again, I just want to know how many hours they were ruptured for. Tear and epi stands for tear and episiotomy. So I have a blank beside tear just so I know what degree that they tore. Diabetic is basically whether or not that patient was type 1, type 2, gestational diabetic, whether it was diet control, like in this case, or whether it was insulin. PIH stands for pregnancy-induced hypertension. So usually if they are PIH, we may need to order labs and stuff like that. So for now, this patient is not, but I'll just put a check mark if they are. HGB stands for hemoglobin. So that's really important to know because we want to know whether or not our patient may need a blood transfusion or a vena for a transfusion. LC stands for lactation consultant. So if they're having any sort of breastfeeding difficulties, I will put a check mark there. And then sutures and staples basically is for your C-sections. So whether or not they had sutures or staples on the incision. A lot of the times patients will have Foley's, so I want to know what time I have to take it out and whether or not they've peed. So that's why void is there. And sometimes for C-sections, we do measure the amount. So I have 2 blanks here for those measurements. Now here I have 2 little sections, which is one for vitals and one for medications, and then also for other. So here I've just filled out some vitals. You'll notice I wrote at you, so that's just where their fundus is. This is also my box for assessments as well. And then medications, you'll notice I have little check boxes here. So I've highlighted them. So then when I'm done the task, I just highlight it so I know it's been done. And anything that's highlighted is something I want to watch out for or I'm looking for to complete. The next section is the baby section over here. So here I will circle whether or not the baby was a girl or a boy, what the APGARs are, what the weight is, whether they're feeding breast or bottle, whether or not they need Q4-hour vitals. In some cases they do. Whether or not it was a vacuum delivery. MEC and void is whether the baby's pooped and peed. So as you notice, I've highlighted void because maybe I haven't seen a void yet or I'm watching out for one, and so I need to keep an eye out for that. Blood work is the time baby's blood work is due. CCHD, whether or not that baby has passed, which is testing for any sort of congenital heart diseases. Billy stands for bilirubin, so we always want to check what the baby's Billy is because we want to know whether or not that baby's at risk for jaundice and phototherapy. Bath, usually we do this at 8 hours, so I put a check mark if it's been done. If not, I will highlight it. Exam is the pediatrician will come and do a newborn exam. Hearing, whether or not that baby needs a hearing test. So again, that is highlighted because here I have an exam and a hearing test that has not been done and I have to kind of watch out for that. DAT and blood type, again, we process this if the Billy is high. And CBC, sometimes babies will need a CBC, so I will check that if it is ordered. Again, another box for vitals, for feeds, and glucose. So again, because this mom is gestational diabetic, I need to be watching that baby's glucose depending on whatever protocol that your hospital uses. You'll notice here for feeds, I have 15/10. So that just is basically left and right breast. And then I also have the time. So at 9 o'clock, this baby fed 15 minutes on the left and 10 minutes on the right. Another thing is sometimes there's always additional tasks. So I actually got this from Muji, and sometimes I will write just on my desk or, you know, on a side note. You can always write the tasks and times and then check them off as you go and kind of just stick it on your patient if there isn't enough room on one of these sections. So for example, if that patient's on antibiotics or whatever, you can definitely write IV antibiotics, and then once it's done you can check it off at whatever time it is. So it's really convenient to use these, but you also have to be careful because sometimes they can come off. They are post-it notes, so just be careful with that. Maybe you can staple it to your sheet, but it is something that's pretty cool that I think keeps you very organized. So thank you guys so much for watching. I hope you enjoyed this video. If there's anything you think I missed that I should be including in my brain sheet, make sure you comment it down below. Or if you have any other ideas for brain sheets, please let me know. Thanks so much for watching, guys. Bye.